Cancer is a formidable adversary, often striking silently and without warning. Its early stages might not present noticeable symptoms, making it difficult to detect until it has progressed. Recognizing these subtle cues can be life-saving, allowing for early detection and timely intervention. Cancer disrupts the body's normal cellular processes, causing cells to multiply uncontrollably. These abnormal cells can invade nearby tissues and organs, compromising the body's balance. Regular checkups and awareness of potential warning signs are crucial in the fight against this often silent enemy. Early detection is paramount in the battle against cancer. When discovered early, cancer is often more responsive to treatment. Individuals can play a pivotal role by paying attention to their bodies and recognizing any unusual changes. Routine screenings and checkups are essential for early detection, especially for cancers that may not exhibit noticeable symptoms initially. By embracing regular screenings, individuals demonstrate a proactive approach to their health and empower themselves with the gift of early detection. While the prospect of cancer can be daunting, knowledge is power. Understanding the signs and symptoms of cancer empowers individuals to take charge of their health. This essay aims to serve as a comprehensive guide, shedding light on the often subtle signs of cancer and providing practical steps for early detection and intervention. It will delve into common symptoms, distinguish between general indicators and those specific to different cancer types, and outline the steps to take if you suspect you may have cancer. Remember, you are not alone in this journey. Support and resources are available to guide you every step of the way. Our bodies often communicate with us through subtle cues. General cancer symptoms can manifest in various ways, affecting different bodily functions. Unexplained weight loss, especially when not attributed to dietary changes or increased physical activity, could be a red flag. Fatigue, a persistent feeling of tiredness and lack of energy, is another potential warning sign. Changes in bowel habits or bladder function can also signal potential problems. Persistent diarrhea or constipation, blood in the stool, or noticeable changes in urinary frequency should not be ignored. Beyond general symptoms, certain warning signs are more specific to particular types of cancer. Persistent coughs, hoarseness, or shortness of breath could indicate lung cancer. Changes in the breasts, such as lumps or nipple discharge, warrant immediate medical evaluation. Skin cancer often manifests as unusual moles or growths. Prostate cancer can cause urinary problems such as frequent urination or a weak urine stream. Recognizing potential cancer symptoms is only the first step. Equally important is taking prompt action and seeking medical attention when necessary. Experiencing any of these symptoms does not automatically mean you have cancer. However, ignoring persistent or worsening symptoms can have detrimental consequences. If you experience any unusual or persistent symptoms, consult with your doctor or a healthcare professional. By paying attention to your body's signals and seeking timely medical advice, you empower yourself to take control of your health. Recognizing the potential warning signs of cancer is crucial, but it's equally important to know what steps to take next. If you experience any persistent or concerning symptoms, your first point of contact should always be your primary care physician. During your appointment, clearly articulate your concerns and describe the symptoms you've been experiencing. Your healthcare provider will also inquire about your medical history, family history of cancer, and lifestyle habits. Based on your symptoms and medical history, your physician will conduct a physical examination. Open communication and a collaborative approach are essential for ensuring you receive appropriate care tailored to your individual needs. Adopting a proactive approach to your health through lifestyle modifications can play a significant role. Quitting smoking or avoiding secondhand smoke is one of the most impactful changes you can make. Maintaining a healthy weight through a balanced diet and regular exercise is crucial. A diet rich in fruits, vegetables, and whole grains, combined with regular physical activity, can help you achieve and maintain a healthy weight. Limiting alcohol consumption is also essential. If you choose to drink alcohol, do so in moderation, following recommended guidelines. Depending on your symptoms, medical history, and the initial assessment by your primary care physician, you may be referred to a specialist. Specialists are medical professionals with advanced training and expertise in specific areas of medicine. Referrals to specialists ensure you receive the most appropriate care from experts in their respective fields. For example, if your doctor suspects a potential cancer related to the digestive system, they might refer you to a gastroenterologist. If your primary care physician suspects a potential cancer related to the breasts, they might refer you to a breast surgeon or a surgical oncologist. Referrals to specialists are not a cause for alarm, but a step to ensure comprehensive care. As you navigate the initial steps of addressing potential cancer concerns, remember that knowledge is power. Empowering yourself with accurate and reliable information can help you make informed decisions about your health. Your healthcare provider is your primary source of information and guidance. Don't hesitate to ask questions, clarify any concerns you might have, and seek reassurance when needed. Numerous reputable sources offer reliable information about cancer, including the American Cancer Society and the National Cancer Institute. Stick to reputable sources and consult with your healthcare provider to verify any information you find online. Embarking on the journey of cancer diagnosis can feel like navigating uncharted territory. Understanding the diagnostic process can empower you to approach this phase with greater confidence. The diagnostic process typically begins with a thorough review of your medical history and a physical examination. Your healthcare provider will inquire about your symptoms, their duration and severity, any relevant family history of cancer, and your lifestyle habits. Based on the initial assessment, your healthcare provider may recommend further tests or procedures. Each individual's diagnostic journey is unique and tailored to their specific circumstances. The diagnostic process for cancer often involves a combination of tests and procedures. One of the most frequently used diagnostic tools is a biopsy, which involves removing a small sample of tissue or cells for microscopic examination. Imaging tests such as X-rays, kinetic scans, MRI scans, and PET scans play a vital role in visualizing internal organs and tissues. Blood tests can provide valuable insights into your overall health and help detect tumor markers. Elevated levels of certain tumor markers can indicate the presence of cancer, but further testing is usually required for confirmation. Receiving and interpreting test results can be emotionally charged. Understanding the meaning behind these results is crucial for making informed decisions about your health. If a biopsy confirms the presence of cancer cells, the pathology report will provide crucial information about the type of cancer and its grade. Imaging test results will be interpreted by a radiologist who will analyze the images for any abnormalities. The radiologist will provide a detailed report to your healthcare provider, outlining their findings. The period between undergoing tests and receiving results can be one of the most challenging phases of the cancer journey, often characterized by uncertainty, anxiety, and a sense of lack of control. It's essential to acknowledge these emotions and seek healthy coping mechanisms to manage the emotional toll of waiting. Open communication with your loved ones can provide invaluable support during this time. Sharing your feelings, fears, and concerns with trusted family and friends can help alleviate emotional burden and foster a sense of connection. Engaging in activities that bring you joy and relaxation can also serve as a welcome distraction from the anxiety of waiting. Whether it's spending time in nature, pursuing hobbies, or listening to music, prioritize activities that nourish your mind and spirit. Remember, you are not alone in this journey. Support groups, both in person and online, offer a safe and supportive space to connect with others who understand the challenges of facing a potential cancer diagnosis. Sharing experiences, exchanging coping strategies, and finding strength in collective resilience can make a significant difference during this uncertain time. Awaiting a cancer diagnosis can feel isolating, amplifying vulnerability and uncertainty. During these times, a supportive network is paramount, reminding us we are not alone. Leaning on loved ones provides an emotional anchor, offering a safe space to share burdens. Talking to loved ones can be incredibly therapeutic. Sharing fears and anxieties can lighten the emotional load. Loved ones offer reassurance, a listening ear, and a shoulder to cry on. Consider joining a support group, in person or online, for shared understanding. Sharing experiences and coping strategies provides a sense of community. Seeking support is a testament to your strength and resilience. Acknowledge you don't have to navigate this challenging time alone. Strategies for managing anxiety and fear. Waiting for a diagnosis can unleash anxiety and fear. Acknowledge these feelings and equip yourself with coping strategies. Mindfulness, meditation, and yoga can help manage anxiety. These practices calm the nervous system and promote inner peace. Engage in joyful activities to distract from anxiety. Spend time in nature, pursue hobbies, and connect with loved ones. Seek professional help if needed. Therapists can provide support and personalized coping strategies. Section 3. The importance of self-care. Prioritizing well-being amidst uncertainty. While navigating the uncertainty of a potential cancer diagnosis, it's easy to neglect our own needs as we grapple with a whirlwind of emotions and medical appointments. However, prioritizing self-care during this time is not selfish, but essential for maintaining physical and emotional well-being. Focus on nourishing your body with healthy foods that provide essential nutrients and energy. A balanced diet, rich in fruits, vegetables, and whole grains, can help support your immune system and provide a sense of physical well-being during a time when your body needs it most. Make sure to get enough sleep, as rest is crucial for allowing your body to repair and recharge. Establish a regular sleep routine, create a relaxing bedtime ritual, and ensure your bedroom is conducive to restful sleep. Engaging in regular physical activity, even gentle forms like walking or stretching, can help reduce stress, improve mood, and promote a sense of overall well-being. Exercise releases endorphins, natural mood boosters that can help counteract the emotional strain of uncertainty. Section 1. The power of early detection. A beacon of hope in the fight against cancer. The prospect of cancer can cast a long shadow, evoking feelings of vulnerability and fear. However, it's essential to remember that knowledge is power, and early detection is our greatest ally in the fight against this disease. By arming ourselves with information about potential warning signs, we become active participants in our health, empowered to seek timely medical attention and improve our chances of a positive outcome. Early detection is more than just a medical imperative. It's a beacon of hope, a testament to the power of proactive health care and the potential for successful intervention. When cancer is detected in its nascent stages, before it has had the opportunity to spread extensively, treatment options are often more effective, and the likelihood of long-term survival increases significantly. Throughout this essay, we've delved into the importance of recognizing potential cancer symptoms, understanding the diagnostic process, and navigating the emotional roller coaster that often accompanies this journey. We've explored the power of seeking support from loved ones and healthcare professionals, recognizing that we don't have to face this challenge alone. Advances in treatment and the importance of hope. We live in an era of remarkable medical advancements. Breakthroughs in chemotherapy, radiation, immunotherapy, and targeted therapies offer new hope. These advancements significantly improve patient outcomes. Immunotherapy harnesses the body's immune system to fight cancer. Targeted therapies focus on specific cancer cell vulnerabilities. Ongoing research continues to expand treatment options. Hope fuels our resilience and belief in a brighter tomorrow.